I'm Patti McNeely. I'm the health coordinator for both Early Head Start and Head Start programs. So I'm the one that's always pushing for everybody to get their hearing and vision tests done and their well child exams and their blood work and all that stuff that has to do with that health. I've worked with the agency for 23 and a half years now. So I've been here a long time. And I just wanted to answer some questions or some of the common questions that are asked today regarding all those health events that happen. There's always questions about the hearing and vision screens that we do. And why do you do it? Okay, and why do you have to use that equipment? A doctor already checked their ears and eyes. Okay, I've been through a lot of reviews. Like I said, I've been here 23 years plus, and I've been through a lot of reviews. That's when the federal officers come to our site, or in this case, this year, it's probably going to be a Zoom, but they come to our site and they look and see if we're doing everything appropriately, if we're following all the regulations. Hearing and vision is required by Head Start. They also require that we do objective testing, which is, a lot of people don't know that word. It took me a while to figure out subjective, objective. Okay, a subjective test is, it doesn't really check for a hearing loss or a vision problem. A lot of times they're just saying, okay, and a reviewer actually used this on me. Yes, they have two eyes and they have two ears, but can they actually see and can they hear? Okay, that's the difference. That's a subjective test. The objective testing is what we have to do, and we have state-of-the-art equipment. This equipment costs over $10,000 for just one set of equipment. It's state-of-the-art. Even the health departments are jealous because we have it and they don't. So we're very fortunate to even have that equipment. And the spot vision screener, it actually will detect if there's a vision problem. If they're seeing or need an eye exam, it'll tell you that. If they have any stigmatisms, anything like that, our vision equipment will tell us that. And from there, we'll say, do you have an eye doctor? Because a lot of times you look at the family, and if mom and dad both wear glasses, they probably already have an eye doctor that they go to. So maybe they can get their child into that same eye doctor, and that would be a follow-up from an exam that we do. The hearing screens are done. They do have to, the spot, they don't even have to touch the child. The hearing exams, they do have to put the little probes in the ears, and we have ones that fit very small ear canals for our littles, and it will detect any hearing loss or any hearing problems. And why is that important? Okay, that the reason it's important is because early intervention is key in anything that we do. We want to catch any problems that there might be early, because you can take care of those problems before anything happens as far as any delays. So it can, before a child starts falling behind on their, development of all kinds, you want to catch that early, and so we can intervene and get the proper care and stuff that you need so that child doesn't fall behind with his age group in development. And the earlier is always the better. Some things that we have found with hearing and vision is we didn't even know it. There was a child that was blind in one eye. And it was like, what a surprise. The parent was surprised. We were surprised. And they were actually, after the testing and it went to the doctor, the child was actually blind in one eye. Wow, isn't that a good thing to know very early? Yes. So we've detected that. We've also detected where children need glasses very early age. And I'm talking about early Head Start and Head Start. And a lot of children end up with glasses because they had some kind of a vision problem. And that's going to be great, because if you can catch that early, it will help with all that learning to read and looking at books and colors and shapes and, seeing is so very important. And as far as the hearing, we've had children who fail the hearing test and they end up needing tubes in their ears, which prevents the fluid behind the eardrum, and it affects their hearing. We've also detected hearing losses, like a permanent hearing loss, and children have ended up with hearing aids. But how important is that? So they don't fall behind on their development for their age. It's very important. So that's why we do it, and that's the importance of it. I'm going to go on to immunizations. Oh, those horrible pokes. Okay, hearing and visions. All parents need to know is that you do have choices. Okay, a lot of parents are afraid that they don't have that choice, but you do. And I want to empower all parents to know that you do have a choice. You have a choice on if they're going to get them or not. You have a choice of how many they're going to get at a time. And you have a choice of 2 different kinds of waivers, whatever they qualify for. Let me tell you about that a little bit. There's 2 kinds of waivers. There's a non-medical waiver, and these are probably the most popular ones. And mostly the reasons are either a religious reason, and they're just waiving all immunizations, or sometimes it's just a personal choice, that you just personally don't believe in them. That's fine too. That's your choice. That's called a non-medical waiver. Now, the non-medical waiver, you have to get at the health department. When I first started at the agency, I used to be able to give non-medical waivers and sign them, and they qualified. The state has taken that out of our hands, and they've only given it to only the health department. So now you have to go to the health department. And in a way, this is good, because instead of myself trying to educate or keep up on all the myths or updates and whatnot, the health department is right on top of that stuff. So why not leave the education part to them? So what they're required to do is, as a parent, you have to call the health department and you make an appointment to get a waiver for your child or your children. And so we have to show you a video, and the video is going to take about 10 minutes is what I'm told. I've asked to look at this video. I said, can you show me this video? I want to be able to tell parents what it looks like or what they're going to do. And so far, I have not been able to get my hands on the video to see what you're going to see. But I've heard that it's very simple, about 10 minutes. And then when it's all over, the nurse will say, do you have any questions for me? Can I answer any questions for you? And if you don't have questions, they're going to say, and now, do you still want the waiver, or did you want to start immunizations? And if you say you want the waiver, okay, and you get it. Okay, that's your choice. Okay, now there's a medical waiver. A medical waiver is not as common, although we have come across it a few times. The medical waiver has to come from a doctor. And the reason a doctor might give you a medical waiver for your child is because the child might be sick, might be getting some kind of medication like a chemotherapy or medication that suppresses the immune system. So they're not going to want to give IMS right away. It could be because grandma, mom, dad might be sick in the household. They've suppressed their immune system with something. And the doctor says, we should wait on those immunizations. So he might give a medical waiver for that, he or she. Another reason I've had this, a child that reacted very violently to a tetanus. Now that's in the DTaP shot, and then you get 5 of those, okay? The child had a severe reaction to this tetanus that was in that shot. The doctor had detected that and wrote allergy to tetanus. that child could not get any more DTAPs because they couldn't take the T out of it. And so he couldn't get any of those shots. It's kind of a shame because that's where the whooping cough is and just a lot of protection in that DTAP shot. But that's a medical waiver. Another non-medical reason is slow schedule. You know how I said you have a choice of getting how many shots at a time? Because I've had several parents get slow schedule waivers. You go to the health department, just like you're going to get a waiver. They ask you why you don't want the immunizations or whatnot, your reason, because they have to put a reason down. And they might say, because I'm just doing a slow schedule, I only want a few at a time. Okay, so instead of the child getting 4 shots in one visit, they might say you can give 2. And then in 2 months, I'll come back and maybe you can give 2 more. Okay, that's called a slow schedule. So you can have a slow schedule waiver. And I've talked to the health departments and they will do it. Claire and Gladwin health departments will give us a waiver, a non-medical waiver, and for a slow schedule. Let's talk about blood work. Okay, in my first life, before I worked for the agency, I worked in the lab and at the hospital. Well, actually, I worked in about every department in the hospital. Before, I worked there at the hospital for 8 years before I even went to school for education, in early education. But anyway, so I know a little bit about the blood work, okay? Now, Medicaid and Head Start require that you have this hemoglobin and lead. Hemoglobin is to check for anemia, and a blood lead is to make sure that the child doesn't have a blood lead level higher than 5. Okay, now I wrote in there, early periodic screening, diagnosis, and treatment. We have an acronym, and you might hear it sometime, that we follow the EBSTAT schedule. Okay, that's just an acronym for what that says. But we do have to follow that schedule of events for Medicaid requirements and Head Start requirements. So in these guidelines, it tells us that a child has to have a 12-month hemoglobin and a lead, and they also have to have a 24-month lead, a blood lead. Okay, now WICs will do this for you and for us. If you're not signed up for WIC, please get signed up for WIC, because there's a lot of benefits for WIC. And they service children up to like 5 years old. So, get signed up if you're not. But they naturally check hemoglobins for anemia. And so therefore they do finger pokes, and they will do a blood lead and a hemoglobin at 12 months. Now, it's not really in their regulation to do a 24-month, which is 2 years old, right? It's really not in their regulation, but all the WIC departments have agreed that they will do it for us. They usually wait until they're 2.5 to do a blood lead after the 12-month. So they're willing to do it at 24 months. Now, the biggest thing I have is I have parents come back, and I really advocate for you guys the best I can, because I tell people, let me know if you have any trouble with the health department, and I will go to bat for you. And most of the comments I get back is that they wouldn't do it. They said they wouldn't do a 24-month lead because I'm not due for it, or the child's not due for it yet. Okay. Every time I call the health department, they said, oh, we didn't know they were in early Head Start. Okay. So I'm going to reiterate again and say, you have to tell them, my child's in school, my child's in Head Start, my child's in early Head Start, whatever you have to tell them. You have to tell them that they're in some kind of a program like ours, so that, or Mid-Michigan Community Action, if you can mention that, then they will definitely do that 24-month lead. Okay. Now, because of the pandemic, the COVID-19 pandemic, they are currently, just like us, we're not meeting face to face, are we? Well, they're not doing bloods and blood draws at this time. Number one, their lead kits are out of stock and they're having a hard time getting supplies to even do it, but they're not even doing face to face yet. And so when they do open their clinics, then we'll start going and getting our blood work done. Until then, if you have a child that's due for their well child exam, you can ask the doctor to order a blood lead and a hemoglobin, and you can, they will place that order and send it to the lab. Then you have to take your child to the lab. Now, don't panic. And I put that in capital letters, don't panic. I've worked in the lab before, and they're like, parents are afraid because they're going to use that needle and they're going to poke them in the arm. Now, they don't have to. Okay. I've had patients come into the lab when I worked there and they'd say, you're not going to use a needle, a finger poke only. Okay. Because I know we can run the test on a finger poke only. So therefore, you're the advocate for your child. Okay. You can walk in there, and if they say they're going to do a needle poke, you can say, oh no, finger poke only. Otherwise, you're not going to do it, because you can do that. You have that power. Also, if you want, you can put the power back on the doctor, and the doctor, when they order it, the doctor can write it, finger poke only on the order. And you know what? We have to follow doctor's orders when that lab work comes to the lab. Okay. So, if you go in for a well child exam, try to get the doctor to order the blood work and go to the lab and get that done. Okay. That's the best way to stay on schedule. Now, and I use the word vampire in there because I used to be called a vampire all the time. And I put, you have rights to tell the vampire in the laboratory that they have to do a finger poke only. Okay. That's why I wrote that in there, because I used to always be called a vampire. Here comes the vampire. Now, always out for that blood. Okay. And I was always as gentle as I could be especially with children. And most people feel that way in the lab. They're going to be as gentle as they can, because nothing's worse than poking a child. Okay. So talking about the well child exams, I just added a little bit on that. Now, I contacted over 20 doctors' offices that have several doctors in one office. And I asked, are you doing well child exams? Are you scheduling them? Yes, we are, they said. Every single one I called. Yes, we are. And I say, how are you doing those? Because parents are afraid to take their child to the doctor at this time. With due cause, it's okay to worry. And I just want to reiterate what they said to me as far as how safe they're trying to be. Number one, and I went for my own well exam, okay, in October. And they were pretty much shut down, but you had to schedule ahead of time. I pulled into the parking lot, I had to call from the parking lot, and then they say you can come up. And then I go up, they take you right in. No waiting in the waiting room, hardly at all. And I asked, what are you doing with the children? And a lot of them will schedule them only in the AM, in the morning, on certain days. Therefore, they're not seeing any sick children, only well children for their well child exams. Okay. So most all those offices that I've called are telling me the same thing. They require masks, hand washing, and, all the gloves, and they're just taking every precaution they can. But you moms and dads are more at risk than the children at this time. Knock on wood, our Head Start has been going in class off and on since August. And I have to track all this COVID stuff and communicable diseases, whether it's flu or pink eye or anything like that. And I'm here to tell you that we have had 0 cases of positive COVID in any of our children. And I have over 400 children that I am tracking. That is good to know. You hear it on the news that children are not these super spreaders like they first thought they were, because that's why they shut down schools in the first place last spring, because they were afraid that children were going to be super spreaders. They're not going to show the symptoms and they're going to spread it. Well, now that we know a little bit more about COVID and we're learning all the time and we're following the science and all that good stuff, I think you moms are more, and myself, we're more susceptible than the children are of getting COVID. So you need to take care of yourself. And the doctor's offices are being very careful with your children as far as scheduling them and taking all precautions. They don't want your children exposed to COVID either.